Hi, everyone. So in this section, we are going to be talking about types of charts and progress note documentation. And this is Dr. Amelia Saul. So there are various different types of documentation formats that can be used when working with clients. There are healthcare monitoring systems, which look at things such as daily vital signs, so weight, pain, blood pressure, heart rate, appetite. And so those are a way for the nurse or the tech or whoever's in charge of going and getting that information on the client daily, that information can be provided through the monitoring system. There also is documentation of ongoing treatment. So treatment notes, which is a main area that recreational therapists write notes for. And so this would be for recreational therapists, occupational therapists, physical therapists, speech therapists, counselors, social workers. All of those people create treatment notes. And so those can be viewed and used by us to understand what everybody else is doing for treatment, how the client is responding to treatment, and is really beneficial in kind of helping with that interdisciplinary work that we can do between all the different types of therapy. There are three general documentation methods. So there is problem-oriented record keeping, or POMR, which is a way to organize by client's needs and used in interdisciplinary documentation. There is source-oriented record keeping, which is organized by discipline, and then narrative format. And so we're going to go through and discuss each of these and some examples of how you would use this. So with problem-oriented medical records, or POMR, this was introduced by Dr. Weed and is a way to be able to focus on what the client's needs are and how you can quickly see what their needs are, what they've worked on, what their plan is in the future, and be able to quickly see all of that information. Within the POMR, it includes data based on initial assessment. So what information did you gather during your initial assessment, and being able to document that. The client's problem list, so areas that they need to work on, areas that they have goals to specifically focus on, their initial treatment plan based off of the initial assessment, progress notes, which are also known as treatment notes, and then discharge summary. So that would come at the end before they are discharged from your location, so or your agency. SOAP notes are often used in the POMR, and so we'll talk about SOAP notes in a little bit, but these are the oldest and most widely accepted general form of POMR progress notes. And so it's really important that as a recreational therapist, you know how to write a SOAP note. And so we're going to be practicing in this class after I show you what SOAP notes are, and we kind of go through the process. There is also source-oriented medical records, which provide information categorized by disciplines, and it's a way for organizing information in patient charts. So everything for specific disciplines would be put together. And then the third type is a narrative format. So this is a chart in chronological order, the events that occur, including the gathering of information. So this is more of like a paragraph that would be written with information about what you did, how you did it, what the client's response was. And so it looks more like you just kind of wrote out a little story or a narrative. And so it uses a sentence structure to kind of provide that information instead of having it split out into different sections. With narrative charting, it is usually the least sought after way of charting because it's very time consuming and can be difficult because it just seems like a lot of sentence fragments put together instead of it flowing appropriately. And so it can be difficult for people to read and understand. Other types of documentation systems. So there are critical pathways or healthcare maps. And so we'll talk about those in a second. There are SOAP notes, PI notes, flow sheets, focus charting, and charting by exception, or CBE. And so we'll talk about these and just give you a brief overview, and then we'll be specifically working on SOAP notes, burp notes, focus charting, and narrative notes in this course. So critical pathways or healthcare maps. So these are management care plans for patients, and they provide the sequence and timing of actions necessary to achieve goals. They are focused on optimal efficiency. With critical pathways or healthcare maps, each patient has a specific sequence of events that should happen during treatment. It's a roadmap that is specific to each treatment plan. So basically, like on day one, the client will do X, Y, and Z. There is variability or variance in critical pathways and healthcare maps. This is the only time where you will write down when they do not stick to the pathway. So when they're not following what they're supposed to be doing, being able to document that will be really important. The idea is that all patients are on a path, and those that vary will need to provide variance. Some of the problems with them is that everyone is not the same, and with this critical pathway or healthcare map, it is putting everybody into the same map, and if they deviate, then that is a problem, even though it could be that maybe that's just not an effective treatment for them or something like that. Some of the benefits is that it provides guidelines which help you know where the patient should be, and the client can see where they're going and gives them direction. And the therapists, if they have typical patients, saves them time and won't have to document anything because your clients are just following the pathway. And then when they're not following it, that's the only time you'll have to document. The next type is a SOAP note. So this is the most basic form of documentation. It was introduced in 1964 by Dr. Weed for treatment team communication. It streamlines changes in treatment and provides easy to see, easy to understand information. It can be used for initial notes, progress notes, or discharge notes. So what is a SOAP note, and why the heck is it called a SOAP note? So a SOAP note is based off of the acronym SOAP. So subjective, objective, assessment, plan. The S is what the client says about the problem and what the client feels. So basically, what is the client's status? So this could be where you would include specific quotes that the client states. So I am feeling very anxious today, for example, would be a quote that you could include. So you'd say client stated, and then in parentheses, what the client said, or not parentheses, in quotation marks, what the client said. And then the objective section, what behaviors, signs, or factual data the staff observed or measured. So this could be things like assessment reports, assessment data. Anytime you meet with the client, basically, you want to make sure that you include that in the objective section. The A is the assessment. So this is where it gets a little confusing, and a lot of people get confused when they are writing one and they've done an assessment, and they'll put their assessment information in the A section, like patient conducted a sit to stand assessment during session on September 17th, 2021. That would go in the objective section. What goes in the assessment section is what information you drew from that assessment. So this would be your conclusions, what you think is going on, your clinical judgment. In that objective section, you're just stating the facts, but in the assessment section, you're going into detail about what your thoughts are on the client based off of evidence from assessments, from what they've said, what they've done, all of that information. And then the plan is what your plan is with the client. What are you planning on doing in the future? What is their treatment plan? All of that. Mostly focused on kind of short term. So what will you be doing in the next week? This is helpful, especially if you were to get sick or something was to happen, that your other therapists could look at your SOAP notes and understand what it is that you are planning on doing with that client. And then there is the PI note, so problem, intervention, and evaluation of care. This is a 24-hour flow sheet combined with progress notes. So with this, what you would be doing is really focusing on what the client's problem statements are and using an approved diagnosis. So with this, problems are labeled giving a number. So just depending on where you're working depends on what that number system will be. Usually this is used more by nurses than it is by recreational therapists, but it still could be used by recreational therapists. Then what intervention you used with that client, and then the evaluation of action or intervention. So if, for example, the client is stating that they are extremely anxious, you provide a stress management intervention, and now, did that help? Did that make their anxiety worse? What happened? And basically evaluating that. There are flow sheets. So flow sheets are graphic records used as a quick way to reflect or show the client's condition. And so they're an easy to understand visual of what the client's current status is. They're often used to document things such as vital signs, medications, intake and output. So what are they eating? What are their bowel movements? All of that information. With flow sheets, they have time parameters, can range from minutes to months. So things like vital signs, for example, you might be doing those every 3 hours or something like that. And so you need to be able to put this into the flow sheet. With focus charting, so this is one that we will be working on. So the term focus was coined to encourage healthcare providers to view the client's status from a positive perspective rather than a negative focus in problem charting. And so this kind of takes a spin. Instead of focusing on the problem, focusing on kind of what you've done with them and how they responded. And so it includes data, so assessment information supporting the focus, what assessments have been done, what information has been gathered, whether that's observations or actual assessments. Actions, so what plans and implementation of interventions was conducted, and then how the client responded. So did they respond well to the treatment or not well? And if so, why? And then sometimes, which we'll talk about when we talk about focus charting, they also have a P for plan, but this is not always included. We will be including it for this class just because it's important to be thinking about that treatment plan, but not always used. Charting by exception, or CBE, is another type of charting system, and this is where only significant findings or exceptions to standards or norms of care are recorded and charted. So you're only putting information in there if it is vital that it's included. If it's not important, then it's not included. Flow sheets and charts are used in which check off marks are recorded. So if certain things are done, then you just kind of check the mark to say that those things have been done. Recording an asterisk means that standards or norms of care were not implemented. So the asterisk also means that a narrative note has been charted to explain why the standard of care was not met or satisfied. With charting by exception, very similar to when we were talking about the other type of charting, which is the critical pathway or healthcare maps, in that with this type of charting, it's kind of the cookie cutter approach where all clients are the same and their treatment's the same, and if there's any deviations, then you chart on that. And so, yes, it's short, like it doesn't take as much time, but it's also making it so that all of your clients are perceived as being very similar to each other, and that there's no real differences, that you're just kind of treating everybody the same, no matter what their needs are or interests or anything like that. Then there is a burp note, and we'll talk about these again more in a future presentation, but these are more common in psychiatric or behavioral health settings, and they are problem-oriented formats similar to a SOAP note. So with a burp note, it's behavior, intervention, response plan. So behaviors are basically things that you have observed about the client. And with these, you'll say things like, client had a flat affect as evidenced by, and then you'll explain why. The I, or the intervention, would include what interventions you did. You would state something like, recreational therapist met with the patient on blah, blah, blah day and did blah, blah, blah intervention. And so you'd be able to have all of that information included. And then response, how they responded to that treatment, and then your plan for what they're going to be doing in the future. Similar to a SOAP note, with having that plan, it's really helpful, because if something was to happen and that you were out sick or something like that, that somebody else could take over and be able to continue on with business as usual while you were away. And here's just one example of a burp note. So B, patient was found crying, curled up in a chair off to himself. So that was the behavior. The intervention, so the therapist offered the individual counseling and encouraged patient to use journaling. The R, or the response, patient appropriately discussed missing his siblings and his concerns about their relationship. And then the P, staff will continue to encourage patient to discuss individual sessions and use journaling. So you can kind of see what that all looks like, and we'll talk about it a little bit more next week when we go into more detail about burp notes, focus charting, and narratives. So that is the end of this slideshow. So the next one is going to be talking about SOAP notes, and then we're going to have you practice on your own, and I'm going to provide feedback on how you did with writing your own SOAP notes.